Good evening, friends. On behalf of Ahmedabad Management Association, it's my pleasure and privilege to welcome Padma Shri Vaidya Rajesh Kotecha ji, Secretary Ayush, Government of India. Kotecha ji is probably not known to Ahmedabad to the extent we should be knowing, but I must say that Ayush Ministry that was formed in the year 2014, following creation of a separate department of Indian System of Medicine and Homeopathy in the year 1995 by Government of India, has really emerging as a superstar for our nation. After Modi ji came into power and assumed the position of the Prime Minister of India, a landmark step that he took was the creation of Ayush Ministry. His vision, I must say, is always long-term. And we did not know his program till Vaidya Shri Rajesh Kotecha ji was given the responsibility as the Secretary of Ayush in the year 2017. And he has been serving that particular position for the last 8 years commendably well. And he has brought Ayush center stage to the extent that the whole world thinks that Ayush is going to really be the path for a healthy India and healthy world. As you all must be knowing, Global Center for Traditional Medicine has been formed by WHO in Jamnagar. It is, as a matter of fact, a great step taken by Government of India along with WHO to mainstream traditional medicines. As you all know very well, we need to now go for a combination of wellness and illness. Until and unless we look at health in totality, we are going to be really a very unhealthy society. I remember going to WHO around 35 years back in Geneva, and I went and asked them as to what is the space for Ayurveda, or what is the kind of position of Ayurveda in WHO headquarters, in WHO offices. And I was really pained to hear that they were not having any knowledge, and they were not willing to admit that Ayurveda is also an appropriate system for keeping ourselves healthy. Ayurveda gives the definition of health, as we know very well, is really the best. You are healthy when all the forces acting within or without are in balance with each other. And that is what, as a matter of fact, is also reflected in the definitions that WHO has adopted. So, wellness was something which was missing, and AMA allowed me to coordinate a set of sessions or set of lectures under the title of New Paradigm in Health, Illness and Wellness, Illness to Wellness and Beyond. We had around 20 lectures in that series in the years 2007, 8 and up to 11 or 12. And we had H.R. Nagendra ji of S. Vyasa, Dr. Prakash of CFTRI, Baba Ramdev, Dr. B.M. Hegde of Manipal, and many such celebrities coming to AMA and sharing their knowledge on the way we can transform the health sector, that is, going from illness to wellness. And I'm very, very delighted that Kotecha ji is precisely doing that. He is trying to really sensitize the whole ecosystem as to what health is. Dr. Kotecha ji is a Padma Shri. He is a distinguished physician, academician, and administrator over 3 decades of service in advancing Ayurveda and traditional medicine. As Secretary, Ministry of Ayush since 2017, as I said, he has led transformative initiatives in policy reform, research, global collaboration, and digital innovation, including the establishment of the WHO GCTM, about which I made a mention. He is former Vice Chancellor of Gujarat Ayurveda University, Jamnagar. He has modernized Ayurvedic education through e-learning, new academic programs, and research excellence. Earlier, he worked with Bharat Ratna Nanaji Deshmukh at Chitrakoot Gramodaya University and led the Chakrapani Ayurveda Clinic with global outreach in 25 countries. An acclaimed author and thought leader, he continues to champion evidence-based Ayurveda and integrative healthcare for global well-being. It's my real pleasure to welcome Kotecha ji, and I would request Divesh Radia ji of AMA, Sunil Bhai Parekh, and Firuz Bhai Khambata to join me in presenting a small token of our love and affection and appreciation for his coming here. So may I request them to come on the stage.
My namaskar to all of you. First of all, I sincerely appreciate and convey my gratitude to Ahmedabad Management Association for inviting me. And also, I am seeing the enthusiastic participation from seniors and the new generation. So thank you so much to really come on the Sunday evening, because originally I was scheduled to come on the Friday evening, and then because of this outrage of flights, etc., I was not able to fly down to Ahmedabad in time. But thank you once more. Actually, I will discuss into three areas with some specific attention. Is about initiatives of Ministry of Ayush, is about some achievements. I will discuss at length about opportunities. This is what I will put more attention to, and opportunities are immense. So actually, I will be also sharing some important documentation, the data of third party. यदि मैं मेरी बात करूं तो बायस हो सकता हूं, but there are some reports, some publications. That is very important. What I will be trying to convey is that this is a very vibrant sector, not per se for the commerce, but also from India's opportunity of global leadership into the healthcare delivery system, because ours is a unique thing. One more thing I want to emphasize is that these are the brands of India. Nobody else owns it. We have to capitalize. The brands are Ayurveda and Yoga. And we are not even visualizing that the value of those brands. And now these brands are coming up. The ministry has formally been formalized by Government of India, by our Honorable Prime Minister. I remember that occasion, that on 8th November, the very same day, Prime Minister came into the validatory function of World Ayurveda Congress at Delhi. I was there. And at that time, I was Vice Chancellor at Jamnagar. And Prime Minister has delivered a very interesting, very encouraging talk. And then the very same night, he may have decided to, in the morning when we woke up, we got this news that the ministry has been formed, a separate ministry. This is a big, actually very big thing, because Nowhere else in the world there is a federal ministry of traditional medicine except Sri Lanka. In Sri Lanka it is there, but it's not having that much of weightage. It is there. You may be aware or you may not be aware, but Ayush has a presence across the country with lot of institutions, 5 research councils, several national institutes and their satellite centers, and then separate commissions, separate pharmacopoeia commission, laboratories, a PSU. This has significance because you can see the presence of this sector is across the country from government. And it has a contribution into different areas. I would like to cite some example, beginning with Jamnagar. Jamnagar is the only institute of national importance in the area of Ayush by Government of India, and it is a very well-known institute. It has a legacy of 60 plus years, and now it is having a reputation that I would like to cite an example that I used to travel across the globe before I joined Government of India and before I became Vice Chancellor. Wherever I would go, people will introduce me as a product, as a postgraduate from Jamnagar. And I can see the respect in the eyes of the people. It is the kind of the reputation this institute has. And this institute is one of the best premier institute having tertiary care hospital and high-end research facilities, which is usually not available in a big medical college also. Their pharmacology laboratory is world-class and well-renowned actually. And they have a lot of such different facilities. We have Awardee Institute of Ayurveda, Delhi. And this institute, it came up only in 2017. Now they have roughly 3,000 patients a day. And then they have 3 months of waiting list to get admitted into that hospital. And it's a world class. So there are so many such examples. We have NIA deemed university at Jaipur. We have National Institute of Homeopathy at Kolkata and Siddha, Chennai. We have Morarji Desai National Institute, Naturopathy at Pune. Shillong, in northeastern India, we have 2 institutes, and in Leh, we have National Institute of Savarikpa. So across the country, we have this presence. And we have 2 national commissions of Indian medicine and National Commission of Homeopathy. Our former chairman of National Commission of Homeopathy is sitting here, Pinakin Bhai is here. And then these are the regulatory body. They brought in transformational change into education. I will talk a little more about that. This is the journey. Creation of the ministry, launch of National Ayush Mission. I will be having some little more discussion about this Ayush Mission, IDY. Then with WHO, we have a lot of things. Dangai said that 35 years back when he went to WHO, nobody was aware about Ayush or Ayurveda. Now what is there? What is the status that I would like to mention? There are a lot of new things happened, and then transformational thing has happened. Then we have WHO Collaborative Center in 2017 came up in Morarji Desai Institute and Jamnagar. We have a lot of agreements with WHO. We have National Ayush Mission is now working with National Ayush Mission in public health area, and then having a lot of good things that I will discuss little more. You can see that as the time goes, the things are more and more, and we have the new campuses of homeopathy, IA phase 2. We are first in introducing pharmacovigilance program into entire health sector. Before allopathic sector, our pharmacovigilance program has started. And now it is robust across the country, having main center is in Delhi at Awardee Institute, and there are several nodal centers and sub-centers across the country reporting pharmacovigilance. The speciality is that they have recorded more than 10,000 such adverse drug reaction of Ayush medicines. But then they followed up and nobody died. So there is no fatal. It's auto recovery. So like if somebody has some diarrhea or something, but everything is recorded and then formally followed up what happened after that. So this is pharmacovigilance program. We have also Yoga Certification Board, Ayush Grid. I will be talking more about these boards and Ayush Grid program. In skill, we have separate sub-council of Ayush, and then now offering a lot of skilling courses. Central Drug Standard Organization, there is a vertical. We have a presence in railways, MSME also, National Institute of Sovarikpa. Then there is a separate Ayurveda Training Accreditation Board. You can see this Ayurveda Yoga Certification Board, Ayurveda Training Accreditation Board. This is outside of the scope of the commissions, that lot of Indian entrepreneurs or schools across the globe are offering courses on yoga and Ayurveda. And there is a need of accreditation and brand India establishment. So we have created this ecosystem. As of now, it is happening through executive orders, but we are proposing the cabinet to get it, big. So it is happening. And then Pharmacopoeia Commission, NIA deemed university, National Commission I mentioned, lot of things. I will not go into details of everything, but the two things I want to mention is the Yogasana is a sport. Ministry of Ayush and Ministry of Sports together worked with Indian Yoga Association, convinced them that we are visualizing Yogasana, not yoga. Yoga cannot be a sport, but Yogasana can become a sport. And they agreed, it happened, and now Yogasana is a showcase game for next Asian Games. And when it will happen in India, it will be an official game. 3 months back, there was Asian Yogasana Championship held in Delhi. Out of 88 medals, 88 gold medals, 85 went to India. What we are visualizing is that in 2034 or 2038 Olympics, it should come as a formal sport, and majority of chunk of medals should come to India, because we are specializing. Ayush in Poshan, I want to cite an example that in Poshan with WCD, Women and Child Development Ministry, we are working closely of Poshan Maha, Poshan Saptah, nutrition perspective. So what we did recently is something, you may find it interesting, that we found a simple Ayurvedic formulation very effective in anemia. We have proof of concept study, a small clinical study in one of the tribal school of Belgavi. We found that from 23% incidence in 6 months, it became 1%, the anemia. So it's a proof of concept, small study. It cannot be implemented as a large-scale public health program. So we tied up with WCD, and a large-scale observation study is going on adolescent girls of Mission Utkarsh. Mission Utkarsh is a 10-district program, most backward aspirational districts of the country. Out of that, 5 districts we have taken up together, and around 80,000 girls have already been enrolled for this study. It's a large-scale observation study. We know what is observation study. When sample size is more, evidence is valuable. It is already going on, about to finish in 2 months, and we have a third party, Public Health Foundation of India is actually evaluating this as a observer, so that there is no bias in this study. We found that in 3 months, average increase of hemoglobin is 2 grams percentage. So it is a possible solution for anemia for country. The same candidate of the drug, we are working with ICMR and doing a large-scale double-blind placebo-controlled study at 11 locations of the country, 11 medical colleges. Same candidate with another perspective of clinical study. It is also happening. More than 4,000 registration has been done. It will finish in next 4 months. So in maybe 6 months, we will have some solution for anemia. So this is something very important that I want to. And then we all know that during COVID, the Ayush did a lot of great work through this interdisciplinary task force. And I remember that when our lockdown happened on 23rd of December, after 1 week, our Honorable Prime Minister had a video conference with sector, the stalwarts of the educationists, professionals, industry, academia, more than 50. So I was there. And after this event, all of them said that we can contribute a lot. So after that event, Honorable Prime Minister called me. He spoke to me. He said that, did you understand what is the potential? I said, मुझे नहीं पता sir, बताइए. So what he said that at this time, nobody knows about COVID. So you are at the same platform, deliver. So I said that I'm thinking of making an interdisciplinary task force, bringing in stalwarts. He said, whatever you want to do, but deliver. Then through this empowerment, we have made this interdisciplinary task force, which has stalwarts of medical science, stalwarts of basic science people, stalwarts of research, practitioners, and these task forces are delivered by identifying different candidates. Lot of studies of different designs has happened, and then we were able to come out with this Ayush 64 and Kabasura Kodinil. These two medicines, one is from Ayurveda, one is from Siddha, and that has been studied in a very short time, like we did for vaccine. It was studied and then standardized for standalone or as an add-on therapeutics for COVID. During second phase, when our country was facing a lot of crisis, we did a study with Ayush 64 on home isolation patient with at home in isolation. 100,000 patients were given this Ayush 64 as an add-on therapeutics across the country with the help of Seva Bharati. And then we had a formal documentation of this 100,000. There was a data cleaning process. 65,000 patients, pakka data, we had that. And we had a publication in Frontiers in Public Health, which is very highly reputed journal. What this outcome is mentioning, that out of 65,000, nobody died. That is something. And less than 300 has to go to hospital. Is only less than 0.5%, where the incidence of going to hospital was around 4.5% at that time. During second wave, less than 0.5% patient went to the hospital and everybody recovered. So that is the outcome. In Kabasura Kodin also, the same thing has happened. Lot of such things are happening, during these days. I will be speaking about this RIS report. I was mentioning about, I have some documentation. So this RIS, Research and Information System, is an autonomous institute policy think tank of Minister of External Affairs. And the independent body, they did a study for us about the sector that I will be mentioning. Then we have Department of Animal Husbandry, MOU with Invest India. This is also very interesting that Invest India, MOU with Invest India has converted into an opportunity of an investment pipeline of $1.2 billion. And out of that, at least $600 million is capitalized, already done, and rest is in pipeline. It is next to semiconductor in investment. So this sector is very vibrant. The problem is that government is not probably, I should look at this, that itna sara kaam karne, pata nahi. Probably because we are not very good into, dissemination or communication, we will improve. You can see lot of these things I will discuss, so I will not go to every detail, but there are some important things that Global Ayush Investment Innovation Summit happened in Gandhinagar. There was 9,000 crore rupee commitment of investment, and we have capitalized 80% of that, which usually do not happen. Global Traditional Medicine Center established at Jamnagar in 2022. And then also we have this Ayurveda AHAR regulation, which will be interesting. I was discussing informally during our, before I came to this, lecture. We had this discussion. I will speak something more about that. I will also speak about the Ayush Vertical at Bureau of Indian Standard, which is a great happening for the business perspective, that, I was discussing about the sector sizes, and our pharma sector is roughly $66-67 billion. Is manufacturing sector. And the Ayush sector, manufacturing, the total sector is 45 billion, but manufacturing is roughly $24 billion. So when we look at the pharma sector's domestic size is also $24 billion. And in Ayush sector, the export is very mere as compared to the domestic size, is only $4.5 billion. So the domestic sector size is $19+ billion, is again $24 billion or $25 billion of pharma. So look at the possibility. We are almost 15% less of pharma, and then huge potential and strong undercurrent that I will be speaking why undercurrent is there. So to capitalize this and to make sure that our exports also grow at a scale up manner, this BIS vertical has happened. I'll be mentioning some documentation about that. Then we have DST, CSR, ICAR, partnership of research, evidence generation. That has converted to some high-end products and some high-end publications. In Ministry of Defense, the Ayurveda clinics is there across the country in DGAFMS. It is already happened. Then we have this Goa campus happened, Ghaziabad, NIH, Narela in Delhi. Another important thing is Ayush vertical at DGHS. And then that has also delivered. I will be mentioning something more about that. ICMR, we have MOU, and then as a part of MOU, we came out with lot of research collaboration. We also establishment of Ayush ICMR, Center of Integrative Research in different aims. This is group of friends in traditional medicine at Geneva. You may be aware that some few years back, when leadership question is there, is only our neighbor, traditional medicine, Dagaji has mentioned that $60 billion business and why we are not able to do that. So we need to have our footprint, our influence globally through lot of such activities, and that is happening at Geneva. So our permanent representative, our PR office has made a group of friends of traditional medicine, having 35 countries and UN offices like WHO, WIPO, South Center. They are all participating. Every 3 months we sit together. Sometimes I go personally, otherwise I participate virtually. And we had a lot of, a lobby of Ayush into the UN agencies like WHO or WIPO. This is barring our neighbor. So we are leader into this group of traditional medicine. Then we have a lot of such activities that I will be speaking more during my discussion. And they are all having separate importance. One of the things is Center of Excellence of BIMSTEC. Our Honorable Prime Minister has mentioned that in BIMSTEC, last year's BIMSTEC conference, that we will establish a Center of Excellence of Traditional Medicine in India, or BIMSTEC. So now we are working on it, and there is a possibility, I'm not sure, that it will happen maybe in next 1 year. We are working with BIMSTEC Secretariat, and it will happen. Then we have also WHO technical brief of mapping application of AI in traditional medicine. I'll be mentioning that, during my course of discussion. Lot of such things has happened. Now, this is very important that I was discussing before this lecture with some informal group of friends here. The question was, one of the journalists, he's here, he was asking me that, why you are not visible? I said, this is a narrative. This is a narrative of intellectuals or, we white collar people who speaks English. But actually the ground reality is different. There is a very strong undercurrent of the demand. And we have requested NSSO, National Sample Survey Organization, to conduct an Ayush survey. And they did it for us. And it is published in 23. The study was done in 22. And across the country, it's a scientific exercise done on 150,000 families. One block of each district of the country has been taken. And what they found is statistically very significant. They found that 95% of rural, 96% of urban population is aware about Ayush. Out of them, 50% is spending money, at least 1,000 rupees per year. When you convert into the numbers, it becomes 70,000 crore rupee. So 70,000 crore rupee is minimum 1,000 rupee. There is more, but minimum 1,000 rupee का benchmark लेते हैं तो 70,000 crore rupee होता है. And then at least 2.5 crore household, one person is doing something of yoga, pranayam, meditation, yoga, asana, something. So this showcases a very, very strong undercurrent and demand of Ayush. We need to capitalize it, not in the form of monetization, but in the form of also monetization, but in the form of providing leadership, having large-scale intervention in public health, and providing global leadership also. International Day of Yoga is one of such event which has a strong footprint across the globe. Look at the participation metrics. Until 2017, we were documenting only main event. But then from 2018, we started trajectory across the country, across the globe. It started from 9 crore and reached to 26 crore in 25. 26 crore people have participated in the IDY event across the globe. It's a formal documentation through large-scale exercise. What is happening is, because of this, yoga became a brand of $100 billion. And yoga is everywhere across the globe. Our Honorable Prime Minister, when he came to inaugurate this World Institute of Ayurveda at Delhi, he mentioned that yoga is now everywhere. It's now the time of Ayurveda. He said that our IT revolution took 20 years to come up to that level. But Ayurveda will not take that much time. He said maybe 5 to 7 years this will happen. And exactly we are here at 7 years after 2017. And we can see that Ayurveda is also globally now at least 25 countries have accepted Ayurveda as a formal system of medicine. And there is an approval of Indian graduates of Ayurveda to practice in those countries, 25 plus. And all of bilaterals, Ayurveda is and yoga is being discussed. All of multilaterals, it is being discussed. And as an outcome, we have a free trade agreement with Australia, and there is a facilitation of Ayurveda doctors getting work permit in Australia or in New Zealand, and then yoga professionals also get work permit in those countries. There are some examples. In Switzerland, Ayurveda is formally recognized. In Switzerland, you have 2 levels of certification, therapist and practitioner, and you have to pass an exam of competence, but then an Ayurveda graduate from India can practice in Switzerland formally as a doctor, as a system of medicine. And Switzerland has actually approved more than 50 Indian pharmaceutical plants in Switzerland, and as per the Pharmacopoeia Commission's Ayurveda Pharmacopoeia. So that kind of development is happening slowly but at a very fast pace. There are some important publications also from the yoga, evidence-based yoga for different populations, geriatric population, children, adolescents, women, mental health. This is another benchmark, देश का प्रकृति परीक्षण अभियान. So we have a tie-up with Institute of Genomics and Integrative Biology. It's a CSR institute, and it is working in this vertical about prakriti of Ayurveda and its relationship with human genome. And they did a lot of good work, lot of publications. They found some evidence that Vata Prakriti, Pitta Prakriti, and Kapha Prakriti and its traits as a genome, human genome. And they did standardize a Prakriti Pariksha format, digital, based on application. That application we have used, and in 1 month, we reached out to 1.40 crore people, and we did that Prakriti Pariksha. And now we are using that Prakriti Pariksha outcome to reach out to them, advising them how to stay healthy, आपकी प्रकृति क्या है, आपको क्या करना चाहिए. Not only that, these database, because it is a database complying with this privacy component, so it is anonymous. And this database, we are also tying up with IGIB to look at, Indian genomics data sets and its relationship with Prakriti. So there is a lot of such possibility. We have 5 Guinness records during this Prakriti Pariksha Abhiyan. Some documentation, it is interesting that 5.6 crore patients are coming only in government opinion institutes. It's only government institutes, not private sector. In our Ayushman Arogya Mandir, we have 12,500 out of 170,000 is only 12,500 standalone Ayush, and roughly 12 crore patients, 11.5 crore patients at this entry level we are seeing every year. This year up till June it was 6, and now it is almost 10 crore, and by the time December it will be 13 or 14 crore. So when you translate it into per day footfall, it is 50 plus. It in a 3,000 catering 3,000 population, 50 plus patients are coming into these facilities, which is very important. It also showcases the demand about the practitioners and dispensaries, etc. Education reforms, I mentioned that I will discuss this. Ayush sector is the first to adopt national education policy in toto. And there are so much Navachar, the new things like electives. Electives are very vibrant. Soft skills, AI in traditional medicine, economics, or entrepreneurship, and lot of such courses they are offering. And students are supposed to do 3 electives per year, but they are finishing 5 or 6 because they are so much enthusiastic because of this innovative, it's online. Then we have also e-learning management system, IT based. We have almost 2 times of the seats, 2 times of the colleges in the last 10 years. I was mentioning about this integrative and collaborative healthcare. We have Ayush vertical at National Cancer Institute, Ayush vertical at different AIMS. AIMS Apex body has decided recently to start an academic Ayush department in every AIMS, every new AIMS. This is a new development. It is already, there is a sample available in Nimhans. Nimhans, there is a department of integrative medicine. Now AIMS has decided they have Ayush in a service block, 30-bed service block, every AIMS. Now they have decided to start academic department with professor, associate professor, full vertical, so that integrative healthcare can be established in our country. This is very new. We have a lot of co-located facilities, tertiary care hospitals like Safdarjung, Lady Harding Hospital. We have also at Labasna, we have an Ayush center. Labasna is a training for the public service officers. So it is there. A lot of such things are happening across the country. The another thing is about Ayush particular DGHS. So they've published IPHS guideline first time in the Ayush sector, Indian Public Health Standard Guidelines. They also published the metabolic disorders guideline, the musculoskeletal disorders guideline, the neurological disorders guideline. It is vetted by the modern medicine counterpart. So this is also where to refer each other, how to develop integrative model. It is happening in government hospitals across the India, because health is a state subject. Some states are very fast, some states are slow, but it is happening. This may be very interesting for you, that I would like to start discussing from here, that until 60 years, pre-2014, there were 6,700 publications in government institutions from Ayush. In 10 years, it is 9,400. जो 60 साल में 6,000 हुआ, 6,500 हुआ, वो 10 साल में 9,500 हुआ. What we did, that when we go to any platform which is not aware about Ayush, the first question what we hear is that आप अच्छा काम करते हो, बहुत अच्छा, ट्रेडिशनल 5,000 साल की, but you have to generate evidence. So this is the reply. Look at that. We have 43,000 plus publications we have indexed. This index is only, they have incorporated peer-reviewed journal publications and index journal publications, 43,000 plus of all, including Ayurveda, Yoga, Unani, Siddha, and it is searchable. You can download full text, you can download abstract, you can even generate reports, how many from diabetes, how many from different areas, clinical studies, preclinical studies, etc. And there are so many high-end publications, including Nature, Cambridge Prism, BMJ. All these publications came up in last 10 years. Just touching the base that we have lot of schemes. Any government, any federal ministry works with the different schemes. So we have schemes in public health, medicinal plant, products and drugs, global collaborations, public health outreach, capacity building, research, innovation, public health, and center of excellences. We had discussion with Peruz Bhai that this industry thing should be more. So I requested him to give me some guidance that what can be done, and we'll be speaking more about that later. But these schemes, under these schemes, we do a lot of different work. There are centrally sponsored schemes working with the state National Ayush Mission. There are central sector schemes where 100% fund come from the government of India. To cite some example, in 2014, the budget of Ayush Ministry in the first year was 691 crore rupee. And this year it is 5,000 crore. So from 691 to 5,000 in 10 years is something very big. And we need more, dil mange more, but it's something, very interesting example of how things are growing. This is also needs your attention, dear friends, that we have visualized an Ayush grid, digitization of Ayush, everything about Ayush. It includes education, research, regulation, startup ecosystem, hospital management information system, and different products, skilling, upskilling, capacity building. So until now, we have been able to launch at least 21 such products and of wide variety, wide range like Yoga Break, Namaste Portal, E-Charak. E-Charak is a buyer-seller platform of medicinal plant, which is one of the opportunity. So cultivators and industry come to same platform and there is a 50 lakh visitation there and more than 80,000 transactions happened in last 3 years. So this is the kind of vibrant ecosystem is there. Is all part of Ayush grid and it is being helped by Baisa which is in Gandhinagar. Baisa is PM Gati Shakti उन्होंने बनाया and the same institute is helping us to develop this Ayush grid. And recently what we did launch a beta version of our Ayush grid. It is maisp.ayush.gov.in. We are developing a master application of Ayush, having all this support system, having different layers, practitioner layer, industry layer, or public layer. There is a core having central government and state government's participation, and this core master application ecosystem has been developed. And now we are working on AI inclusion to that. We started working with it. That is why I mentioned that is a beta version. AI needs more and more training. So I would suggest you to look at this possibility, and then we need more and more documentation. Like for example, we have Ayush-based Health Information Management System, AHMIS, which is digital, which complied with ABDM. And it means that all of these solutions we are putting on sandbox so that entrepreneurs can take it up, have API sharing and develop their own products. So that is very democratic. And then just to give an example, that is Y-Break application is a yoga break, like 6 minutes of yoga program, sitting on the chair in office. In 6 minutes, you can get some capsule yoga, which is very helpful. And we did a lot of study that it is actually helpful for our not only physical health, but mental health and stress alleviation. And it is one of the most popular program in iGOT platform, signed up by more than 1 million government employees on this iGOT platform. So, lot of such different, for example, I want to mention this Ayusoft. Ayusoft is a decision support system having Prakriti analysis metrics, originally developed by CDEC. And CDEC, we have taken over from CDEC and developed it further. So, lot of such things are there. BIMSTEC portal, Ayush Global portal, Ayush Next. These are the different solutions, and these are the a sort of kind of metrics that is available in a dashboard of this website MAISP. Just a comparison that in 2014 we have collaboration, country to country collaboration, 7 countries. Now we have 22. Total collaboration is 103, including institute to institute partnership. So a lot of such partnerships have yielded results. One of the example is Charité University, Germany, which is a very big medical university, very highly reputed across the globe. We had partnership with them, and we did study about the osteoarthritis and intervention of Ayurveda and yoga in osteoarthritis. It was done a clinical study in Germany and in India. And the outcome was that it actually, over the intervention of 3 months, it actually helps a person having also osteoarthritis to improvement of quality of life, mobility, less pain, less inflammation, and subsequently preventing the knee transplant. It is published, it was one of the best publications, got this award in complementary health research in EU. So those kind of outcomes are possible, and then there is a lot. I am just citing some example. I was mentioning about WHO, and WHO partnership has yielded a lot of things, not only this Global Traditional Medicine Center, but another is ICD-11. Publication of second volume of traditional medicine ICD-11. In the ICD-11 is International Classification of Diseases, and there are morbidity codes of Ayurveda, Siddha, Unani published by WHO, supported by Government of India, but more than 25 countries partnership was ensured, and now this ecosystem is available, integrated in electronic health record, and that is helping us to generate large scale evidences and also talking to each other. If an allopathic practitioner doesn't understand what is Vata Vyadhi or what is Vata Rakta, it is possible to interpret through ICD-11 coding that Vata Rakta ko hum kya kehte hain, ya Aam Vaat ko hum kya kehte hain. Those type of convergence is possible. Another possibility which is our insurance companies are now converging is to create their products of insurance sector. There is a new development that IRDA has notified that there should not be discrimination between the packages of Ayush and allopathy for a particular treatment, and it is implemented since 1st April. So this thing take time, but it is happening. We also are leading this focus group on artificial intelligence for health, FGAI4H. So this is a focus group being led by WHO, International Telecom Union, and WIPO. And there are different focus group of neurology, psychiatry, gynecology, all a specialization, but there was no talking group on traditional medicine. So we have proposed that we are willing to lead that, and it should be incorporated. It was accepted. So since then, since 3 years, we did a lot of work into this AI in traditional medicine. One of the example, we are developing an indigenous chatbot on decoding Charak Samhita and Sushru Samhita. It means that if you do not know Sanskrit, if you are not an Ayurvedic professional, you can go to this AI-enabled chatbot and you can decode the knowledge of Charak Samhita in a simple layman's language. So this is also, beta version is ready actually, and we are training this chatbot before we formally launch. And then we have secondment. Dangaji was mentioning that there was nobody there. So we have adopted a strategy to put our men there as a secondment. So we have secondment in WHO, we have secondment at GTMC. They are Government of India men, paid by Government of India, work for WHO, and then progressing with our agenda of traditional medicine and Ayush. So that has delivered. For example, that has delivered into WHO publishing the Ayurveda, Unani, Yoga, and Panchakarma training and treatment benchmarks by WHO. So different countries are using that benchmark to bring in Ayurveda into those countries. This has also happened. Recently, I signed a MOU on behalf of Government of India with WHO DG about the ICHI, International Classification of Health Interventions. So we all talk about Panchakarma, we all talk about different therapeutics of Ayurveda. It's not only medicine, but therapeutics. So we have requested WHO to get standardized this under this ICHI format so that it is spread across the country in a standardized format. So we are working together, and it will happen maybe in 1 year. But this is first because we are the first across the globe about having these ICHI standards of our therapeutics, and that will bring into a lot of transformation. At the same time, I want to also cite one interesting example for all of you, that एज ए प्रैक्टिशनर आई यूज टू टेल कि मेरे पास कोई पेशेंट आएगा तो मैं इनको न्यूरोलॉजिकल डिसऑर्डर में हेल्प कर सकता हूँ पंचकर्म के द्वारा. बट देन इफ समबडी वुड आस्क मी व्हाट इज द मैकेनिज्म ऑफ एक्शन, देन I was not able to. I was able to answer based on the Ayurvedic principles, but not based on the current science or basic science. Current science do not mean all allopathy. Current science is basic science principles, either chemistry, physics or biology, or their outshoots. So we are working with ILBS as a center of excellence about Panchkarma mechanistics. ILBS is a very premier institute of liver and biliary sciences at Delhi. Very well-renowned institute, and we are working on mechanistics like we did for Virechana, we did for Basti Chikitsa. What we found was very interesting. We found that actually this Virechana intervention or Basti intervention corrects the dysbiosis of microbiome. So only since 15 years we are aware about this knowledge about gut-brain connection in Parkinson's and degenerative neurological disorders like muscular dystrophy or multiple sclerosis or those types of disorders where there is no answer. But in Ayurveda, as a practitioner, I would see that if I do Panchkarma, I am able to slow down the progression of the disease or stop the progression. How it happened, nobody knew. But now we are aware that yes, it is happening, and through the standardized protocol of Virechana or Basti, this can be helped. And that's a big breakthrough. It is under the publication. First, we are doing the IPR and then we'll go for publication. In Gandhinagar, our Prime Minister has mentioned, India is celebrating the festival of 75 years and Amrit Kal of next 25 will be the golden period of traditional medicine. And we are actually in toto, we are following up this till 2047. What we'll do, I'll discuss. There are 5 mandates from Honorable Prime Minister. You have to develop startup ecosystem. You have to look at expansion of market size, to look at Ayush visa, which is already notified. You have to look at Ayush Ahar possibility, which is also notified. And you have to work on Ayush mark, the standard Ayush mark that is under the pipeline. What happened next? This is something very interesting that I would like to showcase. This is a third-party study, and our ambitions are very big. In 2014, there is some study of CII which says that this market size at that time was $2.85 billion, manufacturing sector. The another study came out by RIS. It said that in 2020, it became 18.1 billion from 3 billion. When I joined as the Secretary Government of India, I sat with the team and I sat with the industry, and we did set a target that in 5 years from 3 billion, we will reach to 10 billion. It was very ambitious at that time. Then when we found in 2020, it became 18 billion in place of 10 billion. And then as per the projection, now it is almost 25 billion in 2025, 31 billion in 2025. And we have a service sector study also. So together it is almost 45 billion at this time. Our ambition is, with the support of the entire country, our ambition is to reach to 200 billion. At the moment, it is growing at the CAGR of 17%. What we need to do is just to increase 4 more % and it will lead to 200 billion. For that, there is a requirement of strategy and looking at the gaps. Identifying the gaps and addressing those gaps is not government is doing. All of us is required to look at this possibility and capitalize. For example, these are another reports of another Grand View Research, India Brand Equity Foundation, Future Market Report. They are in some of the other firm, they are talking about the same thing. This Grand View Research is mentioning that it is growing at the CAGR of 19.66 and our visualization is 21%. It's only 1.5% more needed. So, for that, what is to be done? That is what I am now discussing. First of all, there should be investment pipeline. There should be some facilitation. So, we have created with the support of Invest India this Nivesh Sarthi portal, which needs popularization. It is just launched. But this Nivesh Sarthi portal is pipeline. If you have some foreign investors, if you want to invest, there are different state facilitation. For example, Chhattisgarh state, I'm just putting an example. State of Chhattisgarh is giving the sector 50% of capital subsidy. If you want to establish there at least a 50 crore rupee center there or manufacturing facility, 50% capital subsidy is available. And then 5 years window of tax rebate, etc. Lot of states are doing this. Uttarakhand state is doing this. Uttar Pradesh is doing this. Gujarat is yet to follow, but this is happening. So, this Nivesh Sarthi portal is one of the pipeline, one of the instrument to capitalize this opportunity. The another possibility is the Ayurveda Ahar. Recently, FSSI has finally published this Ayurveda Ahar regulation, and is now the licensing is available. We were mentioning about the food sector possibility that Ayurveda or Ayush is not just medicine. It is something much more. There is a potential into different areas: medicine plant cultivation, medicine plant trade, industry facilitation, manufacturing, service, medical value travel, research, lot of such possibilities. So one of the possibilities is this Ayurveda Ahar. And then, there is a great opportunity into this area for the new generation people, because I want to cite that at least there are 1,000 startups available in our sector, 1,000. And there are 2 startups that got unicorn in last 7 years. One of these startup became unicorn based on only ashwagandha business of Hyderabad. And another startup is yoga. You may search this Ha-Build Yoga, Saurabh Bothra's creation. And you know what their business model is? that they have subscriber of more than 10 lakh. Every day, at least 80,000, 90,000 people practices into his online classes. And so they charge is only 3,000 rupee, but then it becomes 300 crore rupee at the end of the year. So there's a model. So such models are available, and we are there to facilitate work together. One of the possibilities is Ayurveda Ahar. And then because traditional medicine got a lot of traction, our Honorable Prime Minister always mentions that what is the difference between TCM and Ayurveda is that TCM is largely animal based and our is largely nature based, vegetarian based, plant based, and we need to capitalize it because all over the world people are going towards more and more sustainability, more and more vegetarianism, veganism, or plant-based products, natural products. So we have this opportunity. This opportunity is immense. One more thing I want to mention is that I have 10 minutes more, so I will finish in 10 minutes. One more opportunity is that we need to visualize the brand value of our Ayurveda and Yoga. That is missing. Our startups, they start something they call, this is natural, this is herbal, but why don't you take name of Ayurveda? Why not mentioning Ayurveda? Because this is in people's heart and they will accept it right away. Not only here, across the globe. There is a huge demand, there is huge underutilization of the brand. So that need to be, we need to be attentive to that potential of brand. Then we have some incubation center. I met some couple of incubation, we are working with IDEX platform. You are all aware about IDEX is a defense ecosystem. IDEX has committed to help us to create a startup ecosystem into Ayush sector. So we are working with them. We have already signed a letter of intent with Atal Innovation Mission and IDEX, and we'll come up with something big. As of now, our IA is offering this, AI, IA, ICANN, and then facilitating the new age startups for, by hackathon or by supporting and with partnership with IITs and IIMs, etc. One thing what we did is that we have started capacity building of our team, because if you create a big opportunity and our HR is not competent, is a gap. So not only through education sector, we are also offering or creating lot of such leadership capacity building. For example, now at IIM Kozhikode, our entire team of Ayush, all leaders, all directors of our institutes, their deputies, all of them and some officers of ministry are getting management training at IIM Kozhikode. So that kind of thing is required because unless they visualize what is to be done, how they can translate it, So this is happening. This is also very important development. We all know that pharma sector has this scheme of PRIP. Until recently, there was no inclusion of Ayush. But in last 1 month, there was a review and Ayush is now included into this PRIP scheme. It's a 5,000 crore scheme and that has inclusion for the new drug development and also for the medtech, medical technology. One of the medtech I want to mention is about our partnership with IIT Jodhpur. In IIT Jodhpur, we have Ayurtech Center of Excellence. What they are doing is they are not only doing some digital solutions, but they have developed a prototype for Prakriti analysis where you enter and then lot of sensors are there and then the prototype is actually telling you about your Prakriti and then lifestyle suggestions. This is one of the development. The another development is that they are working on rare diseases and its relationship with Ayurveda and then coming out with solution for rare diseases. So that type of thing is happening. One of the Nadi Pariksha Yantra, Nadi Tarangini, is now approved by CDSCO and this promoter of Nadi Tarangini met me last week. He mentioned that now they have more than 5,000 subscribers at least and across the globe they were able to sell this Nadi Tarangini about visualizing pulse of a person based on Ayurveda parameters. So, lot of such possibilities are there. I also want to mention one interesting thing is that Government of India is working with the industry and developing GLP dossiers of 5 botanicals to make it globally accepted botanical drug in next 5 years. These are Ashwagandha, Brahmi, Shallaki, that is Boswellia, Dana Methi and Salt, ginger. And GLP dossiers are important because unless you have GLP dossiers, you are not able to go to the drug development ecosystem. So GLP dossier is being done. 1.5 years has already gone, and we have first set of safety data is available. Next 2 years we'll be able to get GLP dossier. With ICMR, we are starting on the same 5 botanicals a large scale phase 3 clinical trials. So at the same time we are doing this, maybe in next 2-3 years we'll come up with at least 3 botanicals, which is important because our country has developed a lot of entrepreneurs. We have large pool of knowledge, but we were not able to convert them into actual drug development in our country. Only recently we had first antibiotic ever launched for a lung ailment. This first antibiotic, first drug offered by our country. We are visualizing at least 3 globally accepted botanical drug in next 5 years. And such schemes actually will help the industry to look at this possibility of partnering or developing further. This is also a very novel thing, Export Promotion Council for facilitation. I mentioned during my talk earlier that our sector size is almost similar, domestic size is almost similar to pharma sector, 20% less. So what is the gap? Gap is in export area. We have to do more and more export. There is a huge demand, there is a lot of gap. One interesting example I want to cite is that when our products are gone abroad, the regulators will ask for the standards. आप बताइए इसका क्या standard है? And we are so, no evidence. First we look at the standard. So what we do? We provide pharmacopoeia standard. As soon as we provide pharmacopoeia standard, this is medicine. This is not supplement. It is medicine. It should come under chapter 30 of HS code, and it has very stringent guidelines. So everything is rejected. So that's the modus operandi of regulators there to prohibit. Now, no, but nutraceutical also, when you ask for the standards, where is the standard? So we found the way. No, we found the way actually. We have addressed the gap. That is what I am mentioning. The next is this. Ayush vertical at BIS. In Bureau of Indian Standard, which is responsible, it represents ISO in our country. We have established an Ayush vertical at BIS and already published 200 plus standards, Indian standards of services and products. Parallelly, we worked with ISO and proposed an Ayurveda and Yoga sectional committee. Earlier, we proposed Ayush committee, but then other sciences of Ayush, including homeopathy, there was not such an agreement. So we lost by 1 vote earlier, last year. So this year we proposed, we have amended, and then based on the feedback of our missions, we have proposed Ayurveda and Yoga sectional committee. We won by 22 against 3. So this committee is already there, and in next 5 years we are visualizing that out of these 200, in 5 years it will be another 200. Out of 400 sub-standards, such standards, at least 100 should get ISO standards. This is a route of scaling up of export. You know that ISO standards is accepted in 150 plus countries. And if we export something, they ask for the standards in place of providing pharmacopoeia standards. Same standards, we are modifying it and we are converting it to ISO standards. This is the route which our neighbor has adopted and flourished. So we are doing it. Now, at last, I will just mention about, I already spoke, but mentioned about different categories of opportunities. In startup, we have product manufacturing, cosmetics, nutraceuticals, ahara. Wellness tourism is not only wellness, therapeutic wellness. So people come here for not wellness. There are a lot of different resorts across the globe. Switzerland, सब जगह बड़ा है. हमारे पास क्यों आते हैं? Because we are offering them therapeutic wellness treatments actually, and they are high-end people coming from developed countries and spending here huge money. So we want to capitalize this, and then we are working with state governments to have world standard facilities, globally accepted standards like JCI mark or NABH accreditation, etc. Then franchisees, then digital health platforms like metaverse platforms or teleconsultation, AI-enabled diagnosis, and we are happy to share the solutions which is government have developed by Sandbox. So if you want to develop your product, you are welcome to use these products and then develop your ecosystem based on this platform. There is no IPR, it's open source, so you can use it. Then commerce, management and finance, these are the opportunity for the different courses. I am happy to mention that I just learned that Ahmedabad Management Association is offering a lot of courses of health awareness about, today morning there was a diabetes awareness course. There are a lot of such courses. So why not we visualize these types of courses, like positioning Ayush product globally, or administration roles in hospitals, or management of international trade of Ayush medicines and export hubs, or e-commerce platforms. So those are the opportunities for IMA to look at, and we are willing to partner. Then innovation technology, product innovation, R&D collaboration, technology integration, IoT-based cultivation. This is one of the area where ISRO is helping us for IoT-based cultivation, because when you look at this gap, there is a huge gap of supply chain. Our sector is growing 8 times in 10 years, but then where is the supply? So the supply side is really worrisome. So we need to invest and look at this, possibility of, and also it helps us, to have double of the income of the farmers. Cultivation and cultivation. So we are working with lot of states. States came out with, their support ecosystem. Industry is ready. We had an MOU with export the Manufacturers Association of Herbal Extracts, and they have demanded 10,000 metric ton, 10,000, 10,000, I will convert this again. It's like 100,000 kilos of extract for a year. So इतना सारा demand है उनकी, 10 million ton की demand है उनकी, but there is a short supply. So they signed MOU कि आप farmers को बताइए, we want to sign up contract manufacturing with committed, pricing, etc. We are facilitating them, and we have the eServe platform also. Bioeconomy, sustainability, herbal farming, bioresource utilization, there are a lot of opportunity. Ayush focus management program, I just mentioned about this entrepreneurship, and and then this is our future. We have visualized that maybe we have 5% of our contribution to GDP. We have 10 global academic institutes, Ayush among world top at least 10, or global leadership in AI-driven innovation, 5+ Ayush focused research laboratories with GLP, medical value travel, 100+ Ayush products and services, regulatory framework for ISO standards. So these are the, the goal setting for Viksit Bharat. That's what I wanted to convey.
Degrees picture perspective that Kotecha ji has given us. As a matter of fact, I will say that we were totally ignorant about what Ayush ministry is doing under your dynamic leadership. Modi ji, of course, has been the visionary, but it is Kotecha ji who is implementing, as a matter of fact, the complete vision in a manner that is going to put India ahead of everybody else in the global wellness and global health. And I'm really, very, very happy and really very obliged to him for giving us such a detailed kind of an account of initiatives, achievements, and then lastly, the opportunities. And believe me or not, Gujarat or Ahmedabad has to really pick up Ayush sector seriously. And I would say, sir, that Ahmedabad Management Association is one platform which definitely can act as a bridge between what Ayush Ministry is doing and what the nation needs. And we will be very obliged and will be very happy if you can consider our request to sign an MOU to kind of know and then have people from Ayush coming, disseminating, interacting with the people here, so that whatever you are planning to do across the country, at least in Gujarat, we will be there from AMA. I'm sure there are going to be many questions. So we would like to invite you to raise some queries or questions that you have and to learn from Kotecha ji as to what is the appropriate way to go forward. So may I request, say for the people who are curious to know more or who would like to have a kind of an elaboration of some of the things that he has talked about, to possibly take the mic and speak, or maybe send a question in writing. Thank you. Yeah. Yes, please, sir. Please introduce yourself and then. Yeah.
Very good evening. It was tremendous knowledge shared, and thank you for this. Myself, Dr. Siddharth Kapadia. I am a gynecologist and visiting Africa, 5 nations for medical tourism, MVT, that you mentioned. I come across many government agencies over there, and they are very keen to know more about on Ayurveda. And since you mentioned about the protocols that government is following for standardizing the Ayurveda products into the global market, it is highly, highly profitable market over there. So, sir, how can we connect directly with the Ayush as far as the business is concerned? As the entrepreneurship is in the blood in Gujarat, we like to know more about on the business side. Thank you.
That's why I put more attention to business side because I'm in Gujarat. Actually, the Ayush Export Promotion Council is the agency, which is interface of between government and industry. So I will be happy if you look at the possibility of signing up of a membership of Ayush Export Promotion Council, and their exact task is to connect with the global market and investment opportunities, also global business and facilitation. So this is the exact platform, Ayush Export Promotion Council. I will request you to look at that possibility.
Hello, I'm Lalit Balotia. I'm involved in remote sensing activity for monitoring agriculture. Are there any standards when we say this is product from Ayush or something? You mentioned the ashwagandha thing. Now, ashwagandha has got a lot of things, and every company is claiming it is ashwagandha, which is not necessarily so. So, can you clarify on that? What kind of standards are there when I call my product ashwagandha?
Yes.
Thank you.
Actually, I will cite only because you mentioned ashwagandha. I'll discuss ashwagandha only because there are such things available. There is confusion in the sector also. Like for example, ashwagandha, people use ashwagandha roots, ashwagandha leaves, or together. So Government of India has come out with a dossier on ashwagandha. Is based on available evidences. Because ashwagandha is now questioned because it is questioned that it is one of the top 3 selling supplement in US. Its business has grown to 7 times in 5 years, and one of the ashwagandha company became unicorn in 7 years. So ashwagandha is now competing ginseng. So it is being questioned because it is easy to talk about something safety and create a narrative and creating non-tariff barrier. So what we did is that we have created ashwagandha dossier. It's available in public domain. It's available on our Ayush website, based on large-scale evidences, and talks about standards of ashwagandha and safety, efficacy, safety based on lot of publications. So there are standards available. This is one example. And we are doing for different plants. Now we are working on tulsi, giloy, and then it will come up as a series. But then another thing is that I mentioned about this BIS standard. So BIS standard is ashwagandha standard. We have Pharmacopoeia Commission standard, Pharmacopoeia Commission of Indian Medicine. We have Ayurveda Pharmacopoeia of India. We have Indian Pharmacopoeia. And there are standards available. The only thing is that I admitted that we are not very super good into information dissemination, but things are available. So if there is a specific query, we'll be happy to address this. Export Funds Council is also doing this, is industry facilitation about the standards, what is the acceptable standards of different countries. Actually, they have published it is, you may search it. They have published a document which speaks about export facilitation and regulations of herbal products in different countries. If you want to sell in Africa, there is what is to be done in Uganda, what is to be done in Kenya, what is required in Germany, the regulatory standards, regulatory provisions. So that is also available.
Hello. Please go ahead.
Please, Savle ji.
Yeah. So I'm Dr. Srinivas Savle. I take care of incubation center, Atal Incubation Center at LM College of Pharmacy. We focus only on pharma and healthcare, including Ayush startups. So I was just curious, like other ministries, is Ministry of Ayush planning to promote startup ecosystem, like by providing some seed funding for their research or innovation, taking to the next level of entrepreneurship? Because that is one big boost for startups if they really want to move forward.
I briefly mentioned, but I'll elaborate. I mentioned that we are working with Atal Innovation Mission in Niti Aayog and also IDEX. So we are in the pipeline of developing an Ayush Innovation Launchpad. And it will come up. We are working on this. So before it came up, I should not claim, but it is in pipeline.
Yes.
Hello. Good evening, sir. My name is Jagdish Bhatia. I'm in export business for last 40 years. And there is going to be in Gujarat Chamber of Commerce on 13th of the December. Global trade, I will be taking the session there. It's free. So anybody would like to join there, I will be guiding them about this Ayu products. This is the same subject only. Thank you very much.
This is very good to know.
Very good, very good.
Anybody else? Up.
Yeah. Mike, please.
My interest was nowadays gut microbiome is very important, and Ayurveda definitely affects the gut microbiome. And so there has to be a section, I don't know where it is, but that is focusing on microorganisms and their effect on the health as such, and what is the effect of the Ayurvedic components on those, how to establish a better gut microbiome. Another thing is, there are several products or several microorganisms, but do we look at them as natural products or natural supplements or natural part of Ayurveda? No. We classify them as plants, but why not included in the Ayurveda or some other stream that would be related to gut microbiome? Thank you.
I briefly mentioned about that, but let me explain more. That, the principles of Ayurveda, Panchamahabhut, Prakriti, Dosh, Vat, Pitta, Kapha, and then therapeutics, Panchakarma, is all Ayurvedic person can understand it, but it is difficult to explain it without having mechanistic studies or mechanic aspect or preclinical studies or high-end bioinformatics, high-end computational studies. So what we did as a matter of fact, that we are not only partnering with ILBS, we are partnering with IASC, we are also creating a high-end microbiome lab under our CCRS vertical at Mumbai. And what is the available information now is that now we know for sure that these Ayurvedic principles of Panchamahabhut, Prakriti, Dosh, Panchakarma can be very well explained through this microbiome dysbiosis and symbiosis. And it is very interesting to know that it is very, very easy to look at this possibility of microbiome, different strata, and through high-end computing, how Ayurvedic principles and products and practices do work. So that is the new horizon that we'll be working, and we'll come out with lot of evidences because this is new in next 5 years. We are working on several projects. About considering microbiota as a product of Ayurveda is too much of claim, I think we need to think more about that. We need to discuss more. We need to do brainstorm. In place of by saying yes or no, I would say we need more brainstorm.
Thank you. One last question. Yes, Dr. Lohar, yeah, please. Last question.
Maybe we also address these entrepreneur. No.
One more question.
Good evening and Jai Shri
Okay,
Krishna.
आपका भी ले लेंगे. हाँ, बताइए.
I am Dr. Lohar. I have served Ayush Ministry for 32 years. I was a former director of PLM and HPL Ghaziabad. सर, मैंने 32 साल में बहुत सारे सेक्रेटरीज, हर 2 साल में एक सेक्रेटरी चेंज हो जाते थे, हर बार नई पॉलिसीज, नए डायरेक्टिव्स आते थे, और हम लोग यही लगते थे कि ठीक है, अब नए सेक्रेटरीज आए हैं, अब हमें नया जो है सारा सेटअप चेंज करना है. मगर अनफॉर्चुनेटली सर के ज्वाइन करने से पहले मैं रिटायर हो गया हूँ. आई रिटायर्ड इन 2011. मगर जब से आपने ज्वाइन किया है, एक डिपार्टमेंट, एक स्टेबिलिटी आई है, और कहना चाहिए कि आप सब्जेक्ट के एक्सपर्ट हैं. जो डायरेक्शंस, जो अटैचमेंट आपका आयुष के साथ रहा है, वो पहले के ब्यूरोक्रेट्स के साथ किसी वे नहीं था. उनको तो ये था 2 साल में आए, उन्हें फाइनेंस देखा, एडमिनिस्ट्रेशन देखा. दे आर नॉट कंसर्न विथ एनीथिंग विथ द आयुष, आयुर्वेदा, यूनानी सिद्धा और होम्योपैथी. मगर जो आपका अटैचमेंट और आपका जो डेडिकेशन इस सिस्टम से है, वो हम देख के हम कह रहे हैं कि जो आपने टेक्निकल टर्म्स और जो टेक्निकल डेवलपमेंट आपने किए हैं, और आपके अंडर डायनेमिक लीडरशिप के अंदर जो आयुष कर रहा है, वी ऑल आर थैंकफुल, हाईली ग्रेटफुल कि आपने
कुछ प्रश्न हो तो बताइए.
जी. अब सर, मेन चीज़ ये है, मैंने क्वालिटी कंट्रोल में काम किया है, और उस पीरियड में मेरा कुछ एक्सपीरियंस है, जिसके लिए मेरा आपसे कुछ सजेशंस भी है. मैं आपको 2 एग्जांपल देता हूँ. एक कैंडी जो थी, जिसमें 99.9% शुगर था, मगर उसके लेबल के ऊपर दुनिया भर के जो है जीरा और कहना चाहिए अजवाइन, सौंफ और दुनिया भर की सारी चीज़ें लिखी हुई थी, और उसको एज ए ड्रग लाइसेंस किया हुआ था. जब एक्साइज डिपार्टमेंट ने उसे सीज किया, बोला नहीं ये ड्रग नहीं, ये तो फूड आइटम है. उन्होंने एक्साइज ड्यूटी लगाई. दे केम टू अस के साहब हमें जो है इसको आयुर्वेदिक मेडिसिन सर्टिफिकेट दे दो. मैंने कहा कि हम इसमें कोई भी डिटेक्टेबल थिंग है ही नहीं कि हम इसे सर्टिफाई कैसे करें. इसी तरह से एक दूसरा एग्जांपल है सोना चांदी च्यवनप्राश. जब वो हमारे पास टेस्टिंग में आया, तो हमने पीपीएम तक हम एएस से गोल्ड एनालाइज कर सकते थे, हमें गोल्ड नहीं मिला. जब हमने पार्टी से कहा भाई इसमें तो गोल्ड है ही नहीं, तो उन्होंने कहा कि आप कहाँ तक डिटेक्ट कर सकते हैं. हमने कहा पीपीएम तक. बोला नहीं साहब, हमने तो पीपीबी और पीपीटी तक ऐड किया है. तो सर, इसमें ये एक लेगुना है कि हमारे फार्माकोपिया में कहीं भी रेगुलेशंस में ये नहीं लिखा है कि मिनिमम कंटेंट हमें कितना ऐड करना चाहिए. और जब तक हम ये प्रेस्क्राइब नहीं करेंगे, कोई हमारा जो है क्वालिटी कंट्रोल पर पीपल उसको कंट्रोल नहीं कर सकता.
वेल टेकन. मैं आपको बताना चाहूँगा, बाकी 2 लोगों को अपॉर्चुनिटी देना चाह रहे हैं, इसलिए मैं आपका बीच में मैंने कहा.
जी सर.
अभी नया ड्रग एक्ट प्रपोज हुआ है, पब्लिक हेल्थ, पब्लिक डोमेन में भी आया था, पब्लिक कंसल्टेशन भी हो गया.
जी सर.
इसमें हमने ये पूरे सभी चीज़ों को आपने जो कहा उसको एड्रेस किया हुआ है. सो लेट्स वेट फॉर द न्यू ड्रग एक्ट, इट विल कम.
सर, दूसरा मेरा सजेशन ये है कि जैसे अभी थोड़े दिनों पहले ही यहाँ पे एक वर्कशॉप हुआ था, जिसमें ये था.
लोअर साहब प्लीज,
मेरा सजेशन है, प्लीज. नहीं कुछ नहीं. तो उसमें यह है कि मैजिक रेमेडी एक्ट में बहुत सारी डिजीज़ हैं, 54 डिजीज़ है, जो एलोपैथी वाले क्लेम नहीं कर सकते. मगर हमारे आयुष के फिजिशियंस हैं, बहुत सारे ऐसे फिजिशियन जो बहुत अच्छी तरह से उसे ट्रीट कर रहे हैं, मगर उनके पास में कोई भी डॉक्यूमेंट्री एविडेंस नहीं है. तो मैं चाहता हूं कि सर, आयुष डिपार्टमेंट अगर ऐसे फिजिशियंस को ट्रेस करके आयुष खुद जाए, क्योंकि फिजिशियंस को उसे चिंता नहीं है, ही इज ट्रीटिंग द पेशेंट, उसे कोई मतलब नहीं है कि.
अंडरस्टूड.
सर, लोअर जी,
थैंक यू.
थैंक यू वेरी मच.
आपकी तरफ से एक, उनकी तरफ से 2 क्वेश्चन लेंगे. आप बताइए.
हाँ, नमस्ते सर. डॉक्टर भरत अग्रवाल, डेंटल इम्प्लाન્ટ સર્જન, 3 સ્પેશિફિક. મારા આયુર્વેદા પ્રોડક્ટ ઉપર ઇન્ટરનેશનલ જર્નલમાં પણ રિસર્ચ પેપર પબ્લિશ થયા છે. મોદી સાહેબની જેમ કીધું ગો ગ્લોબલ, મને ઇન્ડિયામાં રસ જ નથી, ગો ગ્લોબલ. આપણે એમના ઘરમાં જઈને આપણું પ્રોડક્ટ વેચીએ તો સાચા કહેવાય, અને એ લોકો ડિમાન્ડ. હવે મારી જે પ્રોડક્ટ છે ઓરલ કેન્સર પ્રિવેન્શન માટે છે, જેમાં આપણે પૂરા વર્લ્ડમાં ઓરલ કેન્સર, હવે એ લોકો મારી એક જેલ છે OSMF ઓરલ જેલ, જે હું અમેઝોન થ્રુ પૂરા 28 કન્ટ્રીમાં અમેઝોન થ્રુ વેચું છું. હવે હમણાં લાસ્ટ એ લોકોએ મારી આયુર્વેદા પ્રોપ્રાઇટરી મેડિસિનને એવું કહી દીધું કે તમે US FDA અપ્રુવલ લઈ આવો. તો આના માટે હું પોતે આયુષ એક્સેલનો પણ મેમ્બર છું. મેં 2 વખત ત્યાં પણ મેલ કરેલા, પણ મને કોઈ રિપ્લાય છે પ્રોપરલી
મેલ કરો, આઈ વિલ એડ્રેસ.
હા,
હું સમજી ગયો તમારી પ્રોબ્લેમ. તમે ફરમાવો છેલ્લો લાસ્ટ ક્વેશ્ચન. એ યંગ પર્સન ઇઝ
Yes, yes.
ઊંચા નીચા થાય છે, યંગ लोगों ने मौको મળવો જોઈએ.
नमस्कार सर, मेरा नाम गौरव शर्मा है और मैं पेशे से बायोटेक्नोलॉजिस्ट हूँ. And currently I am building my startup where we are developing innovations inspired from Ayurveda. और हमारा फर्स्ट प्रोडक्ट जो है दैट इज़ पोर्टेबल धूपन यंत्र, जो कि हमने धूपन चिकित्सा को बहुत ईज करने के लिए बनाया है. तो उसमें मेरा क्वेश्चन ये है कि बेसिकली क्या रहता है कि हमारी जो करंट इनोवेशंस बन रही है, हम उसमें ट्रेडिशनल नॉलेज प्लस मॉडर्न टेक्नोलॉजी को यूज़ कर रहे हैं. और उसमें एक डायलेमा क्या रहता है कि जो एक तो आयुष की स्पेसिफिक गाइडलाइंस है एंड एक साइड हमारी आती है सिडिस्को अप्रूवल बेस्ड, कि हमको उसको भी फॉलो करना पड़ता है. सो हाउ टू गो फर्दर विद दैट, कि हम जो बायोमेडिकल डिवाइसेस बना रहे हैं उसको हम किस तरह से आगे कैरी फॉरवर्ड कर सकते हैं.
There is a facilitation available. It's CDSCO. There is a separate Ayush vertical happened by cabinet in last 3 years. So you may write and copy to us, copy to Secretary Ayush. We'll see, because there is solution available. There is some gap of information dissemination that we'll address.
Sure, sir. I would like to show you the device as well.
As soon as
Sure, sir. Sure, sir. Thank you.
Thank you. I think we can close.
Thank you very much. I would like to say that Kotecha ji has given us an expansive knowledge, but I would like to just make mention of 3 or 4. The first is that AAPI, which is American Association of Physicians of Indian Origin, have created a separate vertical on Ayurveda. And in the US, now they are really being preferred by many people. And AAPI Ayurveda is going to have a conference here in Ahmedabad in the month of January, and we would certainly request Mr. Kotecha ji also to grace that occasion. The second point that he mentioned that is maybe going to be good for all of us to know is that IRDA, Insurance Regulatory Development Authority, has decided to give an equitable treatment to Ayush. Now this is something which is like a music to our ears, and I would like to compliment Kotecha ji to take this great initiative. Because the entire healthcare today is governed by the insurance policies, and if we are not able to get the reimbursement, or if we are not able to get the treatment, then in spite of our being convinced about it, we are not in a position to take benefit of that. So that's a great step, and Government of India and Kotecha ji especially deserves a kudos for that thing. The third thing which he mentioned, and I would like to just highlight, is that rare diseases which are probably possibly afflicting 13 to 14 crore people in the country has got solution only in Ayush, because the modern allopathic system of medicine and the drug companies are not working on it. I happen to be connected with them, and I must say that they want to promote Ayush. And lastly, AMR, antimicrobial resistance, they are not able to find the solutions, and they are also turning to Ayush. So in all, Ayush is a huge ocean of opportunities, and that is what Kotecha ji has given us to understand in very brief. It is up to us to now take it forward and then translate his work, his mission, and his, I would say, crusading efforts, all maybe across in the country, forward to the people, because eventually we have to go for a kind of a vision translation of Arogya Bharati, where I'm National Vice President, and Bhavsar ji is our Sanrakshak. And that's where the 2 objectives, to keep people free of diseases or healthy, and then secondly to take care of the diseases when you are possibly afflicted with it in a pathy agnostic manner. And these 2 objectives are being serviced very, very well by Ayush. We also know that we are talking about climate change, and Ayush is the way forward, because it is the greenest, cleanest, and net zero kinds of systems that we are going to see. I would like to very, very warmly thank Kotecha ji, who, in spite of his busy schedule, came on a Sunday to share his actions and his thoughts and his vision with us. I must also tell you that the registration on Friday for his earlier scheduled program had crossed all the records in AMA. It had crossed 1,000. And we had made all the arrangements to see to it that we accommodate all the people who have registered in different halls so that we can take the benefit of the wisdom, knowledge and experience and the actions of Kotecha ji. So I am very, very thankful to him to spare time on a Sunday to come and talk to us, though we are much smaller in number. But I'm sure YouTube and the other channels are broadcasting whatever he has been revealing to us. And obviously the YouTube recording would also be also there. So thank you very much. Thank you all my friends here who have again come to interact with him. And I'm sure we are going to have many more sessions in time to come from Kotecha ji and Ayush Ministry. So once again, I think we have to stand and greet him and cheer him. Thank you.